Hi, and welcome to our Facebook Live, where UC Davis Mind Institute experts provide information about neurodevelopmental disabilities. I'm Marianne Sharp. Today, we're going to be talking about chromosome 22q11.2 deletion syndrome. It's often abbreviated as 22q. It's 22q Awareness Month, and the Mind Institute specializes in research and treatment for individuals with 22q. We'll be talking about the condition today from both a clinical and a personal perspective with a Mind Institute pediatrician and researcher, and a mom and parent advocate who has two daughters with 22q. Joining me are Kathy Angkustsiri, Associate Professor, Developmental Behavioral Pediatrician, and Medical Director of the Mind Institute's 22q Healthy Minds Clinic. Welcome, Dr. Angkustsiri.
Hi, good to see you.
Good to see you. And Criss Madrigal, mother of two daughters with 22q, a parent advocate, a life coach, a human resources professional at a Fortune 500 company, and there's more. She's also a trainee in the Mind Institute's LEND program that stands for Leadership Education in Neurodevelopmental and Related Disabilities. Welcome, Criss.
Thank you. Thank you for the invite.
Yes, it's so great to have you both with us. To our audience, if you have questions today, please do post them in the comments and we will answer them toward the end of the discussion. I know that we already have a couple of questions that people submitted ahead of time. Thank you for that, and we'll have those lined up in the queue. So I think it's always important to begin by defining what we're talking about. So Dr. Angkustsiri, what is chromosome 22q11.2 deletion syndrome, and what are some of the typical characteristics and health concerns?
Sure. So 22q is a genetic condition that's caused by some missing genetic material on the long arm of our 22nd chromosome. Remember, we all have two sets of chromosomes. The 11.2 in the name actually tells us what position on the 22nd chromosome is involved there. So sometimes people ask us a little bit about other conditions like 22q13, and those are quite a bit different just because they're located in a different area on the chromosome. So like I mentioned, usually we have two copies of every gene. And so for individuals with 22q11.2 deletion syndrome, they're only having one copy of a certain number of genes in that one area. It's usually not inherited, although occasionally we see that it's passed from parent to child. But that's in a nutshell what the condition is and how it's caused. Now, in terms of the characteristics that you see, it is highly variable. There are over 180 different symptoms and presentations that can be involved, although usually each individual doesn't have every single one of that. But it means it might look a little different in each person that has 22q. So it does generally tend to involve medical conditions, developmental conditions, as well as some psychiatric risk. So for medical things, the most common ones we might hear about are congenital heart disease. So parts of the heart may not be formed exactly the way they were supposed to and might need surgical intervention. Many kids have immune problems or difficulties and have to take a little bit of extra precautions. Some other children have problems with their hormones and growth, or that may affect calcium as well. Thyroid, we can see. And then other children have problems with their ear, nose, and throat system, and they may have cleft lip and palate. So those are kind of the most common ones, but there are a lot more in terms of the medical involvement that we can see in 22q. I mentioned some of the developmental difficulties. So early on, a lot of these children may have motor delays or low muscle tone, what we call hypotonia. And so we know that early intervention can really help with some of those things, like physical therapy, for example. Other children may have speech and language delays, and speech and language therapy can be really helpful for them too, as well as special education services or infant development can really help with thinking and learning. So those are common things we see developmentally. And I think, as I just said, speech can be really helpful. IEP services, those are all things that individuals can benefit from, although sometimes it's hard for them to get these services. We can talk about that a little bit more later.
Yeah,
And
definitely.
psychiatric conditions, yeah. ADHD and anxiety in childhood, we can see at higher rates, and even into adulthood, some more serious psychiatric disorders like psychosis and schizophrenia may be at higher risk.
Wow, a lot to take in. I'm curious, how common is 22q? Do we have an estimate?
Yeah, so, an estimate in the literature is that it's anywhere between 1 in 2,000 to 4,000 live births, although there have been some studies that show, looking in pregnancies, that it may be even more common than that, maybe even 1 in 1,000. I think the hard part of it is we don't have studies of everyone, population-based studies, to be able to get the exact estimate, but it's actually quite common for a rare condition.
Right, right. And when is it normally diagnosed? Is it during pregnancy?
It can be, and more recently now, because we're doing a lot more genetic testing and screening during pregnancy, we're picking up 22q as well as other chromosomal disorders during pregnancy as part of the non-invasive tests that are done as routine screening. But even without that, a lot of children might be diagnosed in different periods of the lifespan. So at birth, a lot of the kids who have the cardiac problems, they'll send a 22q test when there are certain medical conditions there. Whereas if, a lot of kids might not have as much of the medical piece, they'll get diagnosed a little bit later if they're having maybe school problems and other things like that.
Okay. Criss Madrigal, let's bring you into the conversation. You are a real expert on 22q as well. Your twin daughters both have the condition. What can you share with us? And this is a huge question, so we'll have time to go through more, but what can you share with us about how 22q affects their daily lives?
Yeah, so thank you, Marianne. So Celeste and Alexia are 11 years old now, and we've learned a lot throughout the years. And at this stage in their life, I think sometimes we tend to forget what is 22q and what is not, just because of our daily living and what we've gone through. But if I had to say how it impacts them today, there's probably two main things that I would point out. And one would be mental health and just how the social and general anxieties play into their day-to-day living, their self-confidence that is associated with it. But I will add that thanks to the Mind Institute, we were able to have them both go through several months of cognitive behavioral therapy with the amazing Dr. Brianna Winder Patel. And that just going through that type of therapy really turned them around completely. It was incredible. I would say the other piece would be kind of the physical strengths and muscle tone type of things going on. So they have both gone to physical therapy since they were 18 months. We did take about a 2 to 3 year break in between. And then I believe it was last year, there was some scoliosis that was detected. Again, thanks to the Mind Institute for making the referrals of all the different things to look out for. There was a little bit of scoliosis that was detected. And since we are not parents that sit back and wait for things to get worse, we put them back into physical therapy just in hopes for it to help them out. And so that has really helped them, but just kind of that physical strength and muscle tone has also kind of spilled over into their confidence to be able to perhaps participate in sports or other activities as well.
You mentioned scoliosis, and earlier, Dr. Angkustsiri, you mentioned heart defects. Let's talk a little bit more about some of the conditions. I believe you said 180 different potential co-occurring conditions. That sounds really challenging to manage. How do you go about doing that? And maybe you could both even answer this because that's a big question. Oh, you're muted, doctor. Sorry.
I was going to say, let me let Criss go first on that, and then I can
Okay.
talk more from a medical perspective.
All
Okay,
right.
sure.
How do we manage? I mean, that's almost a little bit of a tough question. I mean, for us, yes, our girls both had congenital heart defects. They also have one kidney. There was a lot of other things, but it was more of a process of, we're going to go through the day-to-day life, and then as things come up, then we will address them, because knowing that it could affect them in over 180 different ways is extremely overwhelming. So it was a matter of, let's just address the things as they come up to not overwhelm ourselves as well.
Yeah, one day at a time. Yeah. Dr. Angkustsiri?
Yeah, I would say having a good set team of professionals who can help guide you through this. So it's not something you do on your own and you've got someone checking for this and that. And, because it's hard to be the one person that has everything on your plate. That being said, I have to say my experience with families is that usually it is the families that are in charge of running the show and making sure everything's been done. And oftentimes, the parents are in the position of where they need to educate their medical providers about what 22q is. And so kudos to everyone who does that and be able to embrace that role. But you have people here to help, right? So there are geneticists, there are the specialists in each, cardiology and for the kidneys and these other things. And then people like me in developmental peds who also I'm checking all the different areas that your pediatrician can also, your general pediatrician is a great ally for this. There are actually guidelines that were printed out by the 22q Society. We can post them up on our website. And so that's also a nice guide to help remember every year that we're keeping up with all the maintenance so that we know we can look for things ahead of time before they become problems.
Okay, great. We'll look for that and see if we can post it in the comments as well. Sounds like a good resource. Criss, I believe, and correct me if I'm wrong, your daughters were diagnosed while you were still pregnant and you hadn't heard of 22q before. So, what was this early part of your journey like for you and for your family?
Yeah. So that's a bit of a loaded question, if you will, just with the process, but you are correct. We did learn of the diagnosis while I was pregnant, and that was thanks to the excellent team of medical providers that we had at that time. So we feel and we felt grateful for having that diagnosis while still pregnant, because in a way it somewhat prepared us, although you're never really prepared, but it was at least we had answers as to why all these different anomalies were happening. So we had something to point it to, and it gave us a path, and it gave us resources to follow. Now, as far as the early part of our journey, I mean, that's almost like a blur now, but it was full of medical appointments and stress and anxiety, and balancing twins with a variety of needs, and a 2-year-old, and a full-time job, and a marriage, and then burnout and overwhelm. And both girls had open heart surgery, so it was the open heart surgery, the therapies, the kidney that just disappeared and was self-absorbed by their own body, and now they have one. It was like Dr. Angkustsiri said, creating those deep relationships with their medical providers so that you felt confident in the treatment and the guidance that you're getting. And then it was just kind of also managing the separate medical issues that came up actually for myself as well, because of the high levels of stress and the subsequent surgery that came as a result of that, and the family, back and forth again. So it was more than anything, I would say, also a balancing act with everything. And for me, it was a process of faith and trust, and knowing that we were doing everything possible for Celeste and Alexis to thrive in this world.
Yeah, to do it with twins too, so challenging. And they're two unique individuals, right? So they probably each have their own needs and they're not taking the same course, right?
Right. I mean, it's interesting, but I mean, yes. So they're identical twins, and yes, they're their own unique individual selves. But when it has come to their medical history, it's been very, very similar. There may be slightly different variations, perhaps maybe with the anxiety piece and the levels of anxiety there, but it's crazy how similar they also are from a medical diagnosis perspective.
Wow, so interesting. Dr. Angkustsiri, you talked a little bit earlier about the various treatments and therapies. It sounds like there are a lot of different options depending on the needs. Could you talk about what some of those the best options are, and then also what does the 22q Healthy Minds Clinic offer?
Yeah, Great, thanks. I'm going to start with the second question first, and then I'll do the first one. So we have a clinic here. It's a really wonderful clinic that I'm just so happy to be part of, the 22q Healthy Minds Clinic. And it's a little bit different from some of the other 22q specialty clinics that might focus on a specific organ system, like the cleft lip and palate or cardiac or things like that. And so ours is really focused on, it's a multidisciplinary clinic. So we have myself as a developmental behavioral pediatrician. We have a wonderful set of clinical psychologists. So Janice Enriquez and Meg Tudor and Jonathan Bystrinsky. And then we have our social worker, Lisa Chavez Harris, and our wonderful coordinators. And so we're really looking at it from a different perspective in terms of thinking about, as Criss mentioned, all the anxiety these kids often have and trying to be preemptive about promoting healthy development for these kids who we know are at risk, and helping a lot with getting interventions and services, both either through school or other agencies like the regional center, or accessing mental behavioral health benefits. I think regardless of whether or not there's a diagnosis of 22q or a genetic disorder, these are all really incredibly hard systems to navigate and access, especially in this time right now. So that's really our focus, is to help them do better at school, do better in their adjustment and mental health, as well as physical health. So that's our clinic here. And I think parents are a little surprised when they come, in terms of, we spend an entire day with one child. So, I think we feel very lucky to be able to get to know our patients in that way. We're very lucky, because many doctors usually get maybe a 20-minute visit with each child. So we really get to know that child and that family, and help prioritize with the parents and other family members on, really where can we really tune things up or help support extra needs, or, now we have a lot of kids growing into adulthood and really thinking about helping to prepare them for those resources. So that's the first question about the clinic, at least.
Yeah. The second question was about therapies, in case you forgot, because I
Yep.
often forget if I'm going backwards, right?
Yeah. And so, right. So, I mean, in terms of some of the therapies that we might recommend, or that we might say, I think another common theme that comes up is a lot of families, rightly so, I understand you want to be with a provider who knows what 22q is, and they know what they're doing and trusting, but those are hard to come by. And as far as we have all of our knowledge for, very conventional treatments that we have work really well. Like Criss mentioned, cognitive behavioral therapy for anxiety. That's a really good evidence-based therapy that we know works for anxiety, and it works for kids with 22q as well. So I think an important take home I want people to hear is that you don't need a special 22q treatment for any of these conditions that go along, or we see in high frequency with 22q. They're things that are, quite honestly, very common, and we have very good providers who are good at treating these conditions. So the things I like to look for are that they're evidence-based, that we have research that shows that it's effective for what we're treating. And many of these things are low in side effects or things like that, in terms of they're not always medications, right? So therapies are really helpful. I can't stress enough how important early intervention services are, as well as IEP and special education services. And of course, there are times we're going to want to think about medications, like for ADHD or anxiety, and those can be used safely too. We just want to make sure that we're really thinking about all of the other medical comorbidities that are present. So before we treat ADHD, a lot of those medicines may affect the heart. So we want to get the heart doctor involved to make sure that there's not any special precautions we need, or we might use smaller doses, things like that. So they can all be done, just being a little more thoughtful and holistic in making sure the treatments are taking into account other things that are going on with the child.
It's a great point about the fact that these aren't necessarily specific only to 22q patients, but they're therapies that work for many of these conditions, right? No matter what the underlying condition might be. Criss, is there anything that's worked really well for your daughters? You mentioned cognitive behavioral therapy. Anything else that you would recommend that perhaps people may not even be aware is out there as an option?
Yeah, I think what really stands out for me is vision therapy. And that was something that changed my daughter's life completely. And if you want me to expand a little bit more on that,
Yeah.
it was for them, they were struggling substantially when we got to the third grade. And it wasn't for lack of effort. They were trying, we were trying, teachers were trying. And I had a friend who suggested I do vision therapy, and she used it for her daughter, unrelated to 22q. And because we're willing to try anything, we went for it. And they did, I'm going to say, a little bit over 6 months of vision therapy, where it really came down to exercises to get the eyes and the brain to work and interact together. So it was more to improve that brain and eye coordination, to improve the vision functioning. And so the girls noticed the difference. They were able to tell and see the improvements. And it's a therapy, if you will, to enhance like the vision processing skills. Again, like the eye tracking, focusing on eye team abilities, hand and eye coordination. And it's very effective for people that are struggling with reading, with memory, with focus, all things that my girls were struggling with at that time.
Wow, how interesting. And you wouldn't have known to seek it out if you hadn't heard it from a friend.
Absolutely not. It was never
Wow.
brought up in anything.
Wow. Well, I'm so glad that it worked so well for your girls. Okay, we are discussing 22q with a pediatrician and researcher and a mom and parent advocate today. If you're just joining us, we're talking with Kathy Angkustsiri, who is a developmental behavioral pediatrician and the medical director of the Mind Institute's 22q Healthy Minds Clinic, as well as Criss Madrigal, a mom of 2 daughters with 22q, a parent advocate, life coach, and human resources professional at a Fortune 500 company. We have some impressive ladies with us today. If you have any questions, please do post them in the comments. We will answer them toward the end of our discussion, so not too long from now. And I know we have a couple queued up, so keep them coming. Okay, Dr. Angkustsiri, let's talk about research. Is there anything promising that is currently being done?
Yeah, I think what's really exciting right now, and I think a focus is, we talk a lot about children, but these children grow up and become adults. And it's really important to think about how we can support our children as they age into adulthood. So I think there's a lot of groups that are putting a lot more interest into adult outcomes and functional outcomes, and how to support kind of best abilities as we age. There, as I mentioned before, we don't have any specific 22q treatments right now, but certainly in the pipeline for research are a lot of clinical trials specifically for 22q that are being proposed, and we've talked to many pharmaceutical companies are interested in this. And so, stay tuned. We may be able to participate in some of these programs, and maybe, next year there might be opportunities to come up, depending on what new drugs are in the pipeline.
Great. Well, we look forward to hearing more about that. Criss, I wanted to talk briefly, a little bit of a tangent here, but you're currently a trainee in the Mind Institute's LEND program. Again, that stands for Leadership, Education, and Neurodevelopmental and Related Disabilities. This is an amazing program. It's open to self-advocates, parent advocates, researchers, and more, a really diverse group of people. I'm curious what your goals are with LEND, and are you going to focus on 22q? Just tell us about what you're hoping to do.
Yeah, so my focus is 22q, obviously. And honestly, I am doing this to just further immerse myself in just different ways to continue to support our daughters. Also, just how we can continue to advocate for them, advocate for other families living with 22qs. And what I see myself kind of with the LEND program is kind of touching to what Dr. Angkustsiri said, is how can I begin to learn now how to support them as they move into teenage years and then adulthood. And so that's another part. So I'm very excited to hear Dr. Angkustsiri bring that up as well. And honestly, I've always been a person to try to follow my intuition and see where it leads me. And I've been drawn to the LEND program since Dr. Angkustsiri mentioned it. And I feel, a calling to share my story here with this community as well. And while I may not know specifically today how LEND is going to benefit me or benefit my family, all I know is that I'm exactly where I need to be today, here participating in this program. And it's another dot in my life. And it's not going to be until I look back and connect them that I'm going to know exactly what my full purpose was here today. I just know that for the moment, I have the goals of, becoming a better advocate for my children and learning a little bit more as to how I'll try to prepare myself for that transition into teenage years and adulthood.
Well, I can tell you we're so glad to have you and very lucky to have you. So thank you for sharing of your time and your story. Um, I have a question for both of you, which I know I mentioned that it was Awareness Month for 22q. Why is it important that we continue to build awareness of 22q? So many people have never heard of it. And whoever wants to start, feel free.
Go ahead, Chris.
For me, it's simply put, it is more common than people think, but my experience just in speaking with others is that it oftentimes goes undiagnosed for a long time. I meet more families that learn about the diagnosis after they've been struggling, trying to find some answers as to why their children are experiencing the different things that they may be going through. And like I said, I consider myself very fortunate to have had these answers while I was pregnant, which prepared me. And so if there is a way to further advocate so that these things can be diagnosed in advance or early on in life, I think is a win-win for families.
Definitely. And Dr. Angkustsiri, I believe there was a study that you had mentioned that recently wrapped up.
Oh, yeah. So Dr. Tony Simon, who started the program here at UC Davis, we just finished up a 5-year study from NIMH looking at psychosis risk and protection in teenagers with 22q. So they were ages 12 to 18, and we saw them 2 times. Despite COVID, even, I would have to say. So this was an amazing study that just goes to show how dedicated our families are, that they, came back. 95% of our families followed up with us. Even though, we dealt with a pandemic, and for, I think, half a year, almost a full year, we couldn't even have participants come physically to the Mind Institute. So we did make some adaptations in terms of switching things to Zoom and doing some of our evaluations that way for the study. But I still have to say I'm so proud of this 95% retention rate, because you can take a snapshot of symptoms in one period of time, but what we don't know is what happens over time there. So there was a 2 to 3 year gap between when we first saw a child and or actually adolescent, and the second time there. So we're still analyzing all of our data because we just finished up. But one of the big take home points that I hope families are interested in, I know they want to hear about, is how common we were seeing any symptoms and what happens over time with them. And so the biggest thing that struck us was that for this group that is very high risk, we would call, for psychosis or schizophrenia, we actually, again, they're a young group of kids, 12 to 18, but none of the children that came through our study actually converted to frank psychosis or schizophrenia. And so, again, there's still some time that we should be following after age 18, but I was surprised to see that not happen in this larger group of children that we're following who are considerably high risk. When we dig down a little bit deeper, looking at, positive symptoms, which are more of kind of delusions, hallucinations, unusual types of symptoms, those were also fairly not uncommon, but not as common as you would think they would be. They were fairly low, these symptoms, and that, in that 2-year period, 80% of them were either stable or improved. So, I think one of the things to try not to knee-jerk response or respond to right away is there's a big panic when you first see anything, but that if you're seeing any of these symptoms, of course, we should evaluate them and get treatment as needed, but it's not all of a sudden you're on this path that's going to go in this direction or not. We just don't know that yet. And the fact that a lot of their children stayed the same or got a little bit better is pretty impressive to me, or promising. And that, you know, a lot of the more prominent symptoms we saw were what we call more negative symptoms. So less motivation or harder organization, some things that kind of seem more to capture some of the developmental delays and difficulties that a lot of these individuals have. And so perhaps, I mean, there's still a lot more work to be done in looking at what psychosis risk is here, but there's a big overlap in how we measure some of these symptoms in terms of the areas of difficulty that some of these families have. But, you know, I think taken all together, this group at least was doing fairly well. And, you know, I was happy to see that the positive symptoms that we're seeing were not, you know, continuing to get worse or as high as we thought, but we'll have to keep following to know for sure.
Yeah, really interesting findings, especially for parents who have children heading into the transitional time, Chris, and heading into those teenage years. Great. We will be getting to our audience questions next. So last chance to put a question in the comments if you have one. I just have one final question for Chris and Dr. Angkustsiri, which is, what would you like parents whose children have 22q, or even if, whether they've recently received a diagnosis or many years ago, what would you like parents to know? Why don't we start with you, Chris?
I I'd like them to know that, you know, we're all walking similar but very different journeys at the same time, and be willing to try all the different therapies that are recommended, even if it's just a try, you know, a trial. If it doesn't work, it doesn't work. And most importantly, I would say, um, have a vision for how you want to show up for your child. You know, what kind of parent do you want to be for them? And then show up as that parent, because um, our children need us, you know, to be there and fully present with them. Don't do it alone. There's different support systems out there. I did it alone for far too long, and it could be hard. It could be very difficult. So just find your tribe wherever that may be. And lastly, I would just tell the parents to take care of yourself. Take care of yourself, put yourself first, which is very, very difficult, because as moms, as parents, you know, we try to pour ourselves out for our children, which, you know, that's our job, right? But by default, you know, it kind of leads us to get into a little bit of that overwhelmed state and stress along with them. And taking care of ourselves, we show up for them in the best way, and our children need the best version of us out there.
Very well said. Dr. Angkustsiri?
Yeah, I think, you know, I know it's hard, probably learning about a genetic diagnosis or, you know, coming to grips with that. But what I want to say about these kids as a maybe generalization is, the kids I've met with 22q have these amazing personalities and strengths, and they're funny, and they are, they all have their own special talent that is their thing and is great, you know. And so I find joy in that. I find that finding that strength in your child is really helpful in how you integrate kind of this understanding of 22q for your family and for going forward. And, you know, I think initially sometimes it's always with a negative connotation to it. And sometimes, you know, it's because it's not always what we were expecting or wanting. But I think, as Chris mentioned, kind of in retrospect, sometimes you really do see some of the kind of the unexpected talents or the joys or the other roads that it's taking you to, and you understand, gosh, that kid's such a great musician, you know. It's great.
Okay, wonderful. We're going to ask a couple of audience questions here. Actually, we have several, but just as a preface these with The fact that we cannot offer specific medical advice, of course, without having seen a patient, but we can offer general concepts, ideas, and strategies. So the first question is, from a mom who has a child with 22q with multiple medical and developmental challenges. And this mom is worried about the future mental health the most. She says, since she knows that people with 22q have a higher probability of developing anxiety and depression, what are ways that I could best facilitate an environment in which she remains as confident as she is now? And she's a toddler. So, any advice? You might both have good answers for this one. How to facilitate that environment for her?
Yeah, I would say, it's great to be really in tune with your child, so if something's changed or gone differently, because then you might know to bring it to kind of attention to address something. But I think the biggest thing we can do for our children is, especially kids who are, either medically vulnerable or because of developmental delays, sometimes we really just want to protect them. And there's a good reason to do that. But for as much as we can, trying to, kind of not push too hard, but meet our child right at where their needs and abilities are, so that we're always keeping in mind, how can we get them to their most independent self, or how can we get them to their happiest self in that sense. So I find for even older children a little bit, finding what their hobby, their niche, their love is, their strength, the thing they're proud of and brings them joy. I think all of those things are really helpful kind of in the long run picture. And then in terms of for the short term, it's really thinking about good coping skills or how to manage stress. And some of that, as Criss mentioned, comes from our own modeling of how we do it for ourselves. That's really powerful, I think, for our children, because I think, unfortunately, we're never going to be able to eliminate stress or bad things that happen in life, but we can prepare our kids to be able to be resilient and try to handle that the best that they can.
Criss, any advice for this mom?
I can tell you that her story sounds very familiar, because it is something that I would think about often as they were infants, even just knowing that there is a risk out there. And if I could go back, I would probably just take it, one step at a time, one day at a time, and just know that importance of being really in tune with your child to notice when something's a little bit off, and partnering with those providers that are going to guide you in the appropriate steps. Sometimes we get too much in our head and get very scared about the future, because it's scary when you hear all these things. But one day at a time, and seek the help from those experts that can show you the different ways through the different stages in their life.
Okay, this one's a little bit technical. I think actually you referenced this at the beginning of our conversation, Dr. Angkustsiri. Why is 22q shorthand for the deletion in the medical community when there are other types of 22q? So that's a good question.
It
Do we
is
know
a
the
good
answer?
question. I'm not sure I know the answer, but I know that it was, discovered quite, like in the 60s or 70s. So it may be that it was one of the first ones to kind of come up to acknowledgement. And so that perhaps is how it's got its foot in the door.
Right. And you mentioned there's one that's 0.13 that is totally different, right? They're not.
Yes, there are actually different genes that are involved. And so the
Okay.
presentation is different as well.
Okay. All right. Learning something every time I talk with you. Okay. Our next question is, do you offer any virtual services for mental health support? Dr. Angkustsiri, that's one for
Yeah,
you.
that is a great question. So, specifically from our 22q clinic, we do not have telehealth services. Most of our services, like the cognitive behavioral therapy, are out of the General Mind Institute clinic. And so, we can do some kind of consultations through telehealth, though most of our visits are really in person. So it's hard to do kind of our psychological assessments that take like all day long through a telehealth. If you're interested, though, I would definitely reach out and check in with our clinic team in terms of referrals and what needs to happen for that, but it will most likely be an in-person visit.
And we also put the link to the Healthy Minds clinic the 22q clinic in the comments, so you can find that there as well. Okay,
I might want to wait, sorry, before you go on. So I'm just trying to think though about the question in terms of trying to access, more therapies, like, if you're thinking about therapy or things like that, that is actually something that's much better done locally than probably trying to do through us frequently. We're not kind of a weekly type of clinic. We usually are seeing kids maybe, at yearly intervals, if that.
perhaps psychiatry might be a good resource.
Yeah, basically reaching out your mental behavioral health benefits to see who's covered in your area and then being able to work with them. I think telehealth is wonderful, but for some kids, they're going to need to kind of establish that rapport with their therapist. It depends on the personality of the child, I think.
Okay, great. Here is another one. What is the earliest age to consider SSRI for anxiety? Asking about a 4-year-old with anxiety.
Yeah. So I would work with your psychiatrist or developmental behavioral pediatrician to think about, medication options. Certainly, in terms of FDA approval, usually we're thinking around age 6 for most of them. That being said, some children who are more severe might require that earlier. So 4 isn't necessarily too early or out of the question, but it really is kind of a clinical determination of how severe symptoms are. I would definitely think more about it if the child's been through therapies, whether it's behavioral or parent-led, because there can be cognitive behavioral interventions for kids that young, but it's really about doing it through the parent and with the parent to help reinforce certain reactions or making kids more comfortable in other situations. But it really takes a lot of parent involvement, but particularly if that hasn't been successful or that's already been done and it's only gotten you some of the way, or symptoms are so impairing that they're getting in the way of school or leaving the house or doing those things, that those are reasons you might consider it. And certainly there have been trials in kids who have autism of using some of the SSRIs in kids as young as 2 or so. So it's not done a lot, but it's not out of the question, I would say.
Okay, yeah, very informative. Thank you. And this is our last question, and this is a great one for both of you. Any resources or advice on explaining 22q to your young child? And in this case, they're asking about a 5-year-old who has 22q. Why don't you start that one, Criss?
Oh my goodness. That is something that I have struggled with and just even consulted with physicians on the best way of doing it. And the best advice that I was given was just talk to them based on their age and what they will understand. Don't overwhelm them. And for us, we talk about it. It's not part of our day-to-day conversation because I don't like to put labels, if you will, on people, and I don't want that to stick with them. But if they ask, why did I have open heart surgery? Why do I have this or that? I bring it back to there is a 22q diagnosis, and I try to break down that word, or you have 22q and it affected, your heart. You had 22q, so, they had to go in there and fix your heart. So depending on their age has been the type of explanation. And, when they were younger, it was very, very basic. Oh, you had, had to go in there and fix your heart, and just left it at that. And as they get a little bit older, we try to provide just a little bit more context to it, because I do want them to know it's there when they reach the age where they better understand. I want them to know that it's not something that we've been hiding from them, but I also want them to know that it hasn't stopped them from achieving success and where they're at now.
Okay, great.
I would just put a plug out there for, I know the 22q Family Foundation has some good resources too. I know there's even a book, like Faces, I think it's called Faces of 22q or something like that, just to show that there are other people that have 22q and look at them, so that it's, it's not sometimes when you hear some of these, labels or other things, you feel like you're alone or it's just you, and you're understanding, no, there's a whole community and we understand this. And I couldn't agree more with Criss in terms of, keeping it basic and simple for at the right level. And then, I think also you may say it the first time and they don't even seem to really have noticed, and that's fine. When they come to you with questions, or when there are things that are come up where that makes sense to kind of help explain a little more, it's kind of peppered in already so they can get kind of broaden their understanding. And then I would also think about, everyone has strengths and weaknesses. And for some of those things that you struggle with, this is an explanation for why. And that's helpful sometimes for some individuals to know that, oh gosh, I've been trying so hard at this, and it's actually relieving to know, like, oh, this is why. It's not because I can't, try harder. That can be, I think, really, really helpful for some families. But I think that's what parents sometimes worry about in terms of when they hear it, it won't be something that makes sense to them or it helps. It's like an aha thing. It might be a sad thing. So again, every parent knows their child best and how they might respond to it. But those are just things I think about as we talk about that diagnosis. And, when we're, when I think about ADHD and we're talking about, why do I have to sit in the front of the class or things like that? That's another good way to kind of pepper in, that's why I'm taking singing lessons for my singing. I have things too that I'm working on. And so all of us are just, we're lifelong learners, and we're on our path to kind of improve areas that we want to be better in. And so it's not like singling you out because you have 22q and you need this thing. All of us are working on improving all these different areas.
Yeah, that's a great approach. Great message.
The UC Davis Mind Institute was founded in 1998 with a promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.